Alright, hi, my name is Stephanie Hines. This is Sterile Fileld and the wet-dry dressing, changing the dressing. What we're going to do first, of course, is our 7 steps. After that, we are going to come into the patient's room, introduce ourselves, all the 7 steps, set up a garbage pail for everything we need. And then we're going to put on clean gloves. The garbage pail has to be above the waist. Everything is going to have to be above the waist. Once we come here, we're going to get the patient set up and put down a bed chuck or a towel, something in order, if there was spillage, not to ruin the bed. Then we're going to remove the old dressing, gently pulling the tape off in the direction of the skin. And we're going to check the wound for color, for size, for discharge, for any odor. We're going to document everything we need. And then we're going to set up our sterile field. So we're going to take off the clean gloves. Put the towels. Wash our hands in between if need be, but we should have washed our hands before we came in. We're going to open the towel away from us, maintaining the integrity of the inch margin. Take it from the edge. And then we're going to get the basin. And set that on the tray, on the sterile field, close to the patient, but still making sure we have a 1-inch margin all around. Then we are going to use the, we're going to fill this up while it's here. So do that. And get as many gauze pads as we need, at least 5, maybe more depending on the wound. Open these up. We always open everything not on top of the sterile field, either back away or to the side. And we come in from the side. And then last, we're going to set up and put on our sterile gloves, which we also open away from us. Take the cuts. Open this up. And then starting to glove our dominant hand, we're going to take the other hand and touch the inside of the glove. Slide this glove on, making sure not to touch the outside at all. Then, with our clean, sterile hand, we're going to go inside the cuff of the other glove and slide this one on, making sure now to touch only the outside of the glove. Leave that there so it doesn't get contaminated and we don't contaminate our hands. Next, what we're going to do is clean out the wound by taking the gauze, getting it wet, but not too wet. And then with our sterile hand, we'll be cleaning it from the most infected to the least infected, or inside to outside. around the side also, making sure everything's all cleaned up. And then we're going to pack the wound. And put the ADP dressing on also. Uncover it first, of course. Gauze, and then the ADP dressing, which we're going to tape on. And we're going to document after that when we have changed the dressing so it can be done again at the correct time. And then we'll take off the, we'll clean up our sterile field, throwing everything out. And remove the gloves. Sterile field.